Taking a look at the vertebral column as well as the thoracic cage, the rib cage. So the vertebral column goes from the skull to the pelvis. It's also called the spine or the spinal column. Its function is to transmit weight of the trunk to the lower limbs. It also surrounds and protects the spinal cord, as well as providing attachment points for the rib and muscles. Its flexible curved structure has 26 irregular bones that are called vertebrae, and they are divided into 5 major regions. Those would be the cervical, thoracic, lumbar, sacrum, and coccyx. It's about 28 inches long altogether. The top part is the cervical. There are 7 vertebrae within the cervical. The mid part is the thoracic. There are 12 vertebrae within the thoracic region. Each one of those has rib attached to it. Below that are the 5 lumbar vertebrae. And a good way to remember how many of each of those there are, should you ever need to, is that you eat breakfast at 7 in the morning, you have lunch at 12 noon, and you eat supper at 5 p.m. So 7 cervical, 12 thoracic, 5 lumbar. Below the lumbar, there is the sacrum, which is one bone that's been formed by the fusion of several bones, which articulates with the hip. And below that is the coccyx, which is also fused bones that form the terminus, the end of the spinal column, the tailbone, often referred to as. So the curvatures, the 4 curvatures that help the column and increase resilience and flexibility of the spine, there are the cervical and lumbar curvatures, which are concave in the back, and the thoracic and sacral curvatures, which are convex in the back, giving us an overall gentle S shape here. Whoops, sorry. Up here. There are lots of ligaments along with trunk muscles to help support the vertebral column. We have the anterior and posterior longitudinal ligaments, which are continuous bands from the neck to the sacrum that run down the front and back of the spine. They are there to support and prevent hyperextension to the rear and hyperflexion to the front, bending. The ligamentum flavum connects the adjacent vertebrae to each other, and the short ligaments connect each vertebrae to the one above and below. All shown here. The intervertebral discs are cushion-like pads sandwiched between the vertebrae that are going to act as shock absorbers. They have 2 parts to them, the nucleus pulpus, which is the inner gelatinous nucleus, which gives the disc its elasticity and compressibility. And then the annulus fibrosus, which is an outer collar composed of collagen and fibrocartilage that limits the expansion of the nucleus as it's compressed. Here's our nucleus. Here is our fibrous outer layer. Here is an image, looks like MRI image of the discs. So severe physical trauma to the spine can result in herniated discs or prolapsed discs. That usually involves the rupture of the annulus fibrosus and the protrusion of the nucleus pulpus, and that can press on the spinal cord or nerves, causing numbness and or excruciating pain. It can be treated with exercise, massage, heat, painkillers, surgical intervention if non-surgical treatments are not successful. Abnormal spinal curvatures can be congenital, or they can result from disease, poor posture, or unequal pull of muscles on the spine. Some of those would include scoliosis, which is a lateral rotation of the spine, most often in the thoracic region, might lead to breathing difficulties. Kyphosis, often called the hunchback, is an abnormal dorsal thoracic curvature, common in people with osteoporosis, tuberculosis of the spine, rickets or osteomalacia. And then lordosis or swayback is an accented lumbar curvage that can result from disease, but it's also seen in men with pot bellies, and late-term pregnancy in women. So scoliosis, humpback, and lordosis. Vertebrae all have a body referred to as the centrum, which is the anterior weight-bearing region. They have vertebral arches composed of 2 pedicles and 2 lamellae. Pedicles are short pillars that form sides of the arch. The lamellae are fused flattened plates that form the posterior arch. There is a hole called the vertebral foramen that's enclosing where the body and the vertebral arch come together. The vertebral canal is a series of vertebral foramina where the spinal cord is running through, and the intervertebral foramina are lateral openings on the side between the vertebrae that serve as passageway for spinal nerves. So here's our vertebral foramen, and when you put a stack of these on, the tunnel you would get would be the vertebral column. Vertebrae have 7 processes on them. The spinous process projects posteriorly. The transverse process, and there are 2 of those, project laterally out to the side. Superior articulate processes protrude upward, while the inferior articulate processes protrude downward. Here you see them rotating. Notice that the processes in the rear point downward in anatomical position. All right, so let's look at the regional characteristics, starting with the cervical vertebrae. These C1 through 7 are the smallest, lightest of the vertebrae. They are all oval-shaped bodies, with the exception of C7 has a spinous process that are split, called the bifid. There is a large triangular vertebral foramen. The transverse foramen is in each transverse process for artery passageways. And C7 is the vertebra prominens, which is large, and it can be felt through the skin. So when you get into clinical practice, you will use that as a landmark. Again, I will not walk you through each one of these images, but you should go through them in your text. So there are a couple of special vertebrae in the cervical region. The C1 is called the atlas, C2 is the axis, and they have unique features. At C1, the atlas has no body or spinous process. It's really the anterior and posterior arches and 2 lateral masses. Superior surface of the lateral masses is going to articulate with the occipital condyles. The occipital condyles will carry the skull, and its movement of this C1 allows you to nod your head to say yes. So you can think of it as your entire world is inside your brain. Your brain, your world, is carried by your atlas. C2, the axis, has a bony and process like the other vertebrae, but its major feature is a knob-like dens that projects superiorly into the anterior arch of the atlas. So the dens serves as the missing body of the atlas. Dens is a pivot for rotation of the axis, and when you move on the axis, that allows you to shake your head no. In the thoracic vertebrae, we have T1 through T12. They increase with size as they go down. They all articulate with ribs. They are the most typical looking of the vertebrae, I would have to say. The body is heart-shaped with 2 small demifacets that articulate with the ribs. T10 through T12 only have a single facet, not 2. The vertebral foramen is more circular. There's a long, sharp spinous process that points inferiorly. That's what I was pointing out in that picture. It points downward. The transverse process and the transverse costal facets are going to articulate with the ribs, except for T11 and 12. And the location of the articular facets allows rotation of the spine in this area. The lumbar vertebrae, L1 through 5, the small on the back, relieve the most stress, so the bodies are the biggest, most massive. They're short, thick peduncles and lamellae. They have flat, hatchet-shaped spinous process that again points posteriorly. The vertebral foramen is closer to a triangle, and the orientation of the articulate facets locks the lumbar vertebrae down here to prevent rotation. In the sacrum, we have a triangular bone that shapes the posterior walls of the pelvis. It's made from 5 fused vertebrae. Important structures or things on it would include the superior articulate process, which articulates with L5. The articulates inferiorly with the coccyx and laterally with the hip bones through the auricular surfaces, forming the sacroiliac joints or sacroiliac joint. The sacral promontory is the anterior superior margin. The transverse ridges are marks where fusion has occurred between bones. The anterior sacral foramina lie at the lateral ends of the ridges and act as opening for nerves and vessels. And the alae are wing-like expansions. The medial sacral crest is a roughened bumps on the posterior midline and the lateral sacral crest, the roughened area seen on the lateral posterior side. The posterior sacral foramina is a large opening for sacral spinal nerves. The sacral canal is continuation of the vertebral canal, and the sacral hiatus is a large opening at the end of the canal. Coccyx, again, is often referred to as a tailbone. It's formed from 3 to 5 fused vertebrae. It articulates above with the sacrum. In humans, it has very little function. Thoracic cage is composed of thoracic vertebrae posteriorly in the back, the sternum and the costal cartilages in the front, and the ribs on the side. The thoracic cage protects vital organs of the thoracic cavity, lung, heart, anything else in the mediastinum. Supports the shoulder girdles for the upper limbs, provides attachment sites for muscles of the neck, back, chest, and shoulders. Here we see it from the front. The sternum is also called the breastbone. It's actually 3 bones that are fused together, the manubrium, the body, and the xiphoid process. The manubrium is the upper part that articulates with the clavicular notches of ribs 1 and 2. The body is the mid portion that articulates with costal cartilages of ribs 2 through 7. And at the bottom, if you've ever taken a CPR course, you've probably heard of this thing. The xiphoid process is the inferior end that's a site of muscle attachment, and it remains pretty flexible until you reach about the age of 40 when it begins to ossify. The sternum has 3 important landmarks: the jugular notch, the sternal angle, and the xiphohisternal joint. So the jugular notch is a central indentation on the superior border of the manubrium. The sternal angle is a horizontal ridge across the front of the sternum. And the xiphisternal joint is the point where the sternum body meets the xiphoid process and fuses. So that xiphoid process can project posteriorly in some individuals. A blow to the chest at the level of the xiphoid process can push it into the underlying liver or heart, which can cause massive hemorrhaging. Again, if you've ever taken a CPR course, you use that sternal notch as a landmark so that when you do CPR, you don't hit the xiphoid process and cause damage in that manner. There are 12 pairs of ribs that form the sides of the thoracic cage. They all attach in the back to thoracic vertebrae. There are 3 types of ribs, true, false, and vertebral. The true ribs, or the vertebral sternal ribs, that's pairs 1 through 7, attach both to the sternum, are attached directly to the sternum by their own costal cartilage. The false ribs attach to the sternum, but they do so indirectly. 8 and 10 have several costal cartilages that fuse together from the ribs above. And the floating ribs, or false vertebral ribs, are pairs 11 and 12, which do not attach to the sternum at all. So 1 through, I lost my pointer, 1 through 7 you can see here are attached directly to the sternum. 8 through 12 are attached indirectly to the sternum, and then 11 and 12, 8 through 10 are attached directly to the, indirectly to the sternum, and 11 and 12 are floating. So false ribs will include 8 through 12. Floating ribs are 11 and 12. Main parts of a rib: the shaft, the flat bones that makes up most of the rib, has the costal groove, which houses nerves and blood vessels. The head is the posterior end, articulates with the facets or demifacets on the body of 2 adjacent vertebrae. The neck is the constricted portion just behind the head, and the tubercle is the knob-like structure that's lateral to the neck. That's going to articulate posteriorly with the transverse costal facet of the same numbered thoracic vertebrae, shown here. And I believe that covers these 2 sections, and it does.